All right. Hi, everyone. Thank you so much for joining us today. My name is Michaela Johnson, Program Manager with the Big Cities Health Coalition. We're excited to continue our two-part webinar discussion about narrative change, specifically in the context of violence prevention and community safety. 2 weeks ago, Pamela Mejia from Berkeley Media Studies Group provided a walkthrough of how our current media landscape contributes to harmful dominant narratives around violence and safety, and shared strategies for how folks in public health can shape new narratives. Today, our speakers will provide examples of how they're actively working to impact and shape local narratives in two very different settings, those being San Antonio, Texas, and Seattle and King County in Washington. Before we begin, I'd like to thank Prevention Institute, who has helped to co-lead this project. I would also like to thank our funder, Kaiser Permanente Center for Gun Violence Research and Education, which is powered by the Health Alliance for Violence Intervention, for their support. Similar to the first webinar in this series, there are a few tech-related things that I would like to mention. While meeting attendees are unable to unmute or come off a video, we do encourage folks to use the chat box to leave comments and ask questions throughout the presentation. We'll plan to go through as many questions as possible at the end. I will now pass the mic to our first speaker today, Nathan Brown with the American Indians in Texas at the Spanish Colonial Missions in San Antonio, Texas.
Thanks, Michaela. Let me share my screen here. I'll show the presentation. And can somebody give me a verbal?
We're all
good.
good.
You can see the screen?
Yep.
Awesome. Thank you so much. So, hello, everybody. My name is Nathan Brown. I'm the Youth Leadership Development Program Manager at American Indians in Texas at the Spanish Colonial Missions. I'll share a little bit about our organization in this next slide and a little bit about the work that we do in our youth program. Today's topic is about narrative change and how the narratives around community violence shape what's happening in terms of policy, funding, and even within our communities internally. So my presentation will be a little bit from a boots on the ground perspective of what's happening within the community and what we're doing to address it. Of course, we're trying to address some of the policy and funding aspects from a local level and on a national level as well. A lot of the examples and things that I'll share are just based on working directly one-on-one or in group settings with clients, families, and parents and youth. And so if you have questions, please feel free to put them in the chat. I'll have a quick little interactive question for everyone to put a little answer in the chat so we can participate a little bit virtually. But I'll dive right in. So a little bit about our organization, AITSCM, AIT, American Indians in Texas. You'll hear me use all three names because we have a really long acronym and a really long name. But we are a Native American organization in San Antonio, Texas. We were started 31 years ago. A lot of the work that we do is surrounding narratives in different aspects. As a Native American organization existing in a state like Texas, which has a history of erasing indigenous peoples and their cultures, a lot of the work that we do is making the invisible visible. And that's kind of a theme that we have in our Indigenous Cultural Arts programs and department. We have an Office of Community Engagement, which is focusing on the policy side, especially for a Native-focused rights and supportive services for Native identifying community members. And we also, in addition to these programs, have a family-based services, which is applicable and usable by all community members, regardless of if you identify as Native American or not. Actually, a majority of our clients currently are Hispanic. Because we live in San Antonio, Texas, which is a majority Hispanic city, a lot of our clients are very diverse and not necessarily identify as Native. And so we have a really wide depth and breadth to the services that we provide San Antonio community members. In terms of our family services, a lot of what we're trying to do is bringing healing to community members living in narratives of normalized violence for victims and offenders. And so we work, and what we'll discuss today is we're actually working with both sides of harm, the offender or the victim. And what we do in our different classes, our curriculum, our mentorship sessions, is we kind of break down narratives of how normalized behaviors began, what was normalized for our offenders, And what you really realize in having conversations with people and trying to process harm through a restorative justice approach, which is kind of infused in all of our programs and departments, is that you understand that some of the narrative surrounding violence and what is normalized for folks was taught at an early age, and some of the offenders were originally victims as children themselves. So we'll dive a little bit more into that. But first, as a quick icebreaker, I'd love to hear your thoughts in the chat. Please feel free to put this in. But I'm interested, we have participants from around the country. What narratives exist in your communities around family and youth violence? So please feel free to put this in the chat. We'll highlight a couple things that are common themes. So I'll go ahead and let people answer. What narratives exist in your communities around family and youth violence? So while we're waiting for a couple folks to put something in, some common narratives that come up in the work that we do is that family violence is, when working with parents or participants, we hear that violence is something that they just grew up seeing. Parents didn't raise their children properly if they're in trouble. It only happens to people in poverty or in under-resourced communities. Youth who commit violence aren't youth. That's a great one, something we'll touch on. Another one is that bad people do bad things, right? Like if people are doing violence or harm against others, then they are they are the bad guys. There's no compassion, right? We kind of live in a tense world right now where it's easy to label people quickly without understanding perspectives. Youth who have been involved in violence are lost forever and can't change. Yeah, having a growth mindset and understanding the change that people can have, the transformation through healing. Yeah, these are great answers. So just for the sake of time, thank you for everybody who participated. I'll move on a little bit. Just so everyone can understand some of the work that's happening in San Antonio, some of the areas that we work in San Antonio are really resource limited areas. These are areas where the narrative is um, around poverty, violence, drug abuse, substance abuse issues, mental health issues. For example, where our youth program office is located right now, where I am, we're in the 78207 zip code, which has 40% of the households living below the poverty line. We have the highest crime rate, uh, arrest rate for drugs. We have regularly people on the street. I mean, just the other day, I was walking out to my car and I saw people vandalizing a car and graffitiing. It's just kind of normalized things that happen in our area. And so there's a narrative around San Antonio that you stay away from the west side. You stay away, especially from the inner west side where we are close to downtown. So there's this intersection of poverty and family violence as well. A lot of our clients for our parenting services, we work with domestic violence cases, we work with child abuse cases, we work with specialty court partnerships where people are coming to us from the justice system who have been arrested for family violence and substance abuse issues. There's a huge intersection in our areas that we're working in of poverty and family violence. So normalized family behaviors and generational trauma are actually typically left out of this narrative. There's just an understanding that people are operating, this is the way that things have always been, this is what I saw, these are just bad people doing bad things. And we don't really have, as a city and even as a society, an understanding of how people and systems and communities were shaped by different things. And so, traditionally, this is maybe a concept that is new to some folks, but traditionally, our justice system operates in a punitive approach where we frame the law as the ultimate end all be all. So when people break the law, that's what is being broken when there's harm. You're offending the law that was written to keep people in order. And so AIT and our different family-based services are trying to provide a countercultural, restorative, and healing-centered approach to family and victims. What this means, this could mean a few different things. We operate circles where sometimes victims and offenders may be in the same room, and we're talking about what the harm was done and what the victim needs to move forward and how the offender may be able to provide, uh, whether it's an apology for smaller instances when we're working with youth, or if we're working on a domestic violence family level, this is like a really serious issue where we're talking about the harm that was done to somebody and what they need to move forward and what action needs to be taken, whether that's restitution of personal property, or we need to have a separation of some sort. We also provide most of our classes happen separated between victims and offenders. So we're having a community circle where people can talk about their shared experience, um, whether it was on a victim side. So they're talking about this is what happened to me. This was my experience. This is how it impacted my kids and my family. But also on an offender side, we're having people come from the courts and referral systems from caseworkers and or probation officers. And this could be youth. This could be parents. Um, when we're doing this, family members are sharing, this is the action that I took in the past. This is what I did to hurt my family. And this is also kind of internalized things that I grew up in. This is the narrative surrounding how we did discipline in my household. Um, this is how we raised children, whatever it is. So we're trying to change clients' perceptions ultimately of what is possible, what is healthy behaviors, what our children need, what the narratives around trauma are. Trauma is like kind of a word that some of our community members react negatively to. I don't have trauma. Like that's like PTSD stuff from war. No, traumatic things can happen throughout your life and they build up and they have an impact, whether it's just small microaggressions or whether it's small instances that you tried to block out. This shapes who you are as a person and who you become as a parent, as a youth, as a community member, as a professional in whatever, job you take on later on in your life. And this is applicable, most importantly, the narrative we're trying to change is that this happens to offenders and victims alike. And as I mentioned earlier, when we're doing some of our really intense specialty court partnerships where we're having people come for domestic violence cases, we're talking to the offenders about their story, about their upbringing. And we really realize in those cases and in those stories that people that created this harm later on in their life, they experienced it as a child originally. So there's this cycle of violence that's happening that people aren't talking about in our communities. And so when we're able to have these conversations and bring this to a higher level to our policymakers, our representatives for city council, for our state representatives, our federal representatives for government, we're able to try to influence policies to be compassionate, to be more restorative focused, less punitive focused, because we know that based on research, a lot of the punitive approaches to discipline in schools, disciplinary approaches like throwing people in jail for smaller crimes, it doesn't prevent recidivism. It actually increases and it keeps people in a cycle of violence and trauma and further crime down the road. So how AIT is trying to change the narrative. A lot of our framework is operated through culturally based curriculum that are evidence based, and our framework is really encapsulated by the phrase "la cultura cura." So in Spanish, this means culture heals. So when we use culturally relevant activities, discussions, topics, it connects to people differently than a generic curriculum that is written for a different audience member. So a lot of our curriculum is written especially for Latino communities, and it's from an indigenous perspective as well. So understanding that we're all indigenous to somewhere, understanding some of the traditional values that have been passed down, traditional values meaning trust, love, dignity, and respect. So understanding how can we live out those values, how have we not been shown those values in our upbringing, and what can we do to create healing in our families. Other ways that we're trying to change the narrative and involve community members, where we get community feedback, we do pre-tests, pre-surveys, we receive evaluations from parents. We also involve PLEs, people with lived experience in the work that we do. So, for example, some of the work we're doing in our community on the east side in San Antonio, which has the lowest, it has the highest, birth mortality rate in San Antonio, Texas. We're working with people with lived experience who are single mothers or single parents. They've gone through some of the traumas that we're talking about with our clients, and they're helping shape the work that we're doing and making sure that it's relevant, appropriate, and responsible for the work and for the situations that our clients are going through. As I mentioned, we're also using evidence-based curricula, and the curriculum has demonstrated evidence in reductions in recidivism, violence, substance abuse, and producing positive behaviors and attitudes. For our youth program specifically, this is the program that I manage, as well as some management of some of our family-based services. We're trying to provide alternative approaches to behaviors for youth. For instance, some of our work is involved in gang intervention or prevention. So some of our kids that are at risk of getting involved in gang activity, who are coming to us through the county juvenile system, coming out of juvenile detention, we're trying to provide positive developmental relationships for them to understand responsible, healthy behaviors, understanding like this may be something that was modeled for you, or this is something that was normalized for you. This was the narrative that you were told about who you could become. I think someone mentioned earlier that, a narrative is that youth are told that when they commit crimes, that's all they'll ever be, right? So something that we talk about with our kids is what are some of the stories or narratives that you've been told based on maybe it's the color of your skin, maybe it's based on the neighborhood you grew up, based on your barrio, maybe it's based on um, San Antonio, Texas, or based on having come out of juvenile detention. How did your teachers look at you? How did your family members look at you after coming out? And when we understand some of the narratives that are playing out in our clients' lives, we can have compassion for them and also help them to realize the more affirming and restorative approaches to healing. So, how AIT is continuing to change the narrative, we're revealing and telling stories about how trauma and intergenerational relationships shape violence and harm. So, when something is normalized, we all live in a normalized bubble. Whatever my parents did, that is the typical thing. That's the way you do parenting. That's the way you do overseeing schoolwork. That's the way you work. That's the way you party, whatever it is, right? We all have a normalized system of beliefs based on our parents and what was modeled for us under like social cognitive learning theories. So when we're able to break down some of the things that our clients have faced growing on in their previous upbringing, it helps us to be compassionate and to reshape some of the narratives so that they can move forward in a healing way. We're trying to tell our stories through social media, community collaboratives, coalitions. We're a big part in San Antonio of the work around domestic violence, prevention, and intervention. And ultimately, this is a phrase that we take from Jerry Theo and the National Compadres Network in California. We're transforming instead of transferring trauma. So, what we tell our clients, especially in our domestic violence um, programs, is that trauma that's not transformed is transferred onto your kids, onto their kids, onto their kids, right? It's a generational cycle of violence. And so now I just have a few examples from some of the work that we're doing on a youth perspective, because this is the work that I do most often. This summer, we hosted a dating violence intervention and prevention workshop with youth from around the city who were involved in 3 days of activities, discussions, brainstorming. How can we be activists in our community to highlight the issue of dating violence? How does it occur? What are the narratives that exist among teens and from our parents, maybe that shape the likelihood of violence? This is how people behave in a relationship. This is what you're supposed to do in a relationship as a man, as a woman, as a person of a certain identity. We also doing empowering retreats. So we're trying to teach positive narratives about where our youth come from, who they are. And this is especially related to the indigenous identity of our youth that we're working with. Whether they identify as Native or not, understanding your indigenous roots, especially if you're from a country in Latin America, understanding where you come from and your ancestors' strength and roots and how you're here today, that's a really affirming way that we're trying to reshape the narratives and build our youth up to be responsible community members. We're doing nature retreats and fun activities. These are some of my favorite pictures. We're doing some plant identification, teaching youth about the beauty of South Texas. It's not just this dry desert. Taking youth out of their neighborhoods and trying to help them understand the beauty in San Antonio and the surrounding areas so that we show them there's another world out there besides what is normalized for you. Um, let me see what else we have nature retreats, leadership activities, team building exercises. This is some of the work we like to do with our youth program. We have some more instances of our culturally based programming using lessons around making tortillas by hand and how there is ancestral wisdom in that and how we can connect with our family members and break cycles of violence. We have storytelling sessions with the Citizen Center down the road with our youth, so they get to learn perspectives from our seniors about about their lives, what was normalized for them, what life looked like for them, and how things change over time, trying to expand our youth's minds and helping them understand the world around them. So how are things now? As I'm starting to wrap up, from 2022 through the present, only one youth that has graduated our youth program in partnership with Bexar County Juvenile Probation has reoffended. So that's a 2.6% recidivism rate versus the county units that they're operating out of are at 24% recidivism. So we know that the work that we're doing is impactful because we have 10% of the recidivism rate of our county juvenile probation units. We have a specialty court partnership in Bexar County where San Antonio is located, which was recently awarded the #1 specialty court in the state of Texas. So there's a growing transformation in San Antonio and Texas from punitive to restorative justice. People are starting to catch on to the idea that maybe the way that we approach discipline and punishment for crime is not working, right? This is something that people have been talking about for decades, but public policy members sometimes are slower to catch on to some of these things, right, that we've been talking about. So we're trying to change public perception of violence, how it happens, why it happens in our communities, and how we can address it instead of approaching it through a punitive approach, through a restorative approach. Our executive director was recently named the Peace Laureate for San Antonio this last year, and we have strong partnerships with CPS, Department of Family Protective Services, and our state agencies that are helping us to continue to mentor and serve more than 1,500 clients per year. Some of the evidences of changes, we have youth that are reoffending at extremely low rates coming out of juvenile probation. So they're stuck in that cycle of violence, and yet when they come to our program and they graduate from it, there's demonstrated evidences of change. You can see on the right percentage of justice-involved youth that completed our program. 67% of the kids that come to a class end up finishing the whole 20 hours of community service in our program. So it's a large ask to be a part of such a large community service initiative. But once they come to one class, 2/3 of them are graduating. We have demonstrated evidence in creating positive change and emotional regulation in our youth. Did youths demonstrate change as it relates to knowing their strengths and weaknesses? We're working with some of the toughest of the tough kids who have gone through some of the toughest of tough situations. And so the evidence that we are demonstrating to our county partners, to our funders, is that this work it's working. It's making an impact on our community members. And so this is something really positive that's happening in San Antonio, Texas. So lessons learned. My final slide, we have a few different lessons that we've learned over the years in our 31 years of doing this work. We have strong relationships with schools and nonprofits and local government, and these are essential to the relational work that we do with our community members. If you want to meet people where they're at, you have to go to where they're at. So we need to work really closely in hand with our school districts, nonprofit organizations, and our local government to create impact. Another lesson learned, changing the dominant narrative around punitive justice, around why community violence happens, the existence of generational trauma, the cycles of violence. This is slow and painful work. It's hard. You're trying to change generations of impact in some of our cases, we're trying to change that and plant seeds in 10 weeks. That's hard work, and it takes a lot more than 10 weeks of work to do that. But when we change the narrative around generational trauma, victims, offenders, family violence involved participants, we create opportunities for people to create compassion, to create solutions that get to the heart of the problem. And then finally, a positive impact on one youth or one adult can create a ripple effect of positive change across generations. So when you are able to transform trauma you will be able to prevent transferring trauma onto future generations. So we know that just working with one youth over time may feel discouraging, but it can create a lifetime and a ripple effect of positive impact. So that's most of the information I have. I believe we're going to have a Q&A at the end. So I'll pass it off to the folks from Seattle. But if there's anything else, any questions, I'd be happy to answer that. Thanks so much for your involvement and participation.
Thanks so much, Nathan. Also want to highlight some kudos that you received in the chat for the amazing work that you are doing. Really appreciate you being here today and sharing that. And as you mentioned, we will now transition to Ariana Donneville and Karen Brownson from Public Health, Seattle and King County.
Thank you. I will go ahead and share my screen now. And similarly, if I can just get a verbal, we see it.
Looks good.
Beautiful. Okay. Well, I am Ariana Donneville, and I'm here with my colleague Karen, who will introduce herself in a hot second. And we're going to share a little bit about narrative change and action and what we're doing over in Public Health Seattle and King County. And then let's see if I can advance it. Boom.
Yeah.
Technology's working for me today, you guys.
Fantastic. Hi, everybody. My name is Karen Brownson, and I'm part of the Violence and Injury Prevention team at Public Health Seattle and King County. I run a program called Lock It Up that does safe storage, firearms promotion and support. I also do all of our firearm policy work, and I sit on the Safe States Alliance's executive committee. I've been at Public Health since 2016 and have backgrounds in both youth organizing and suicide prevention. And I'll let Ariana say a little bit more about her work at our health department.
Yeah. So again, I'm Ariana Donneville, and I serve as our communications specialist for our King County Regional Office of Gun Violence Prevention. Our office takes a public health approach to gun violence by collaborating with community and across systems to collectively address gun violence in King County. So that looks like we fund a community violence intervention initiative. We also fund a hospital-based intervention program at our local Trauma One hospital in King County. We have a youth ambassador program, and we work with our municipal partners across different cities across King County to address gun violence in our county. And so with that, I will advance to the next slide, which just gives a little outline of what we plan to cover. So during our session, we're going to talk about what the narrative was around public safety and gun violence in King County around the time that I at least first started. And I know, Karen, you've been with the county for some time. And then what we did to address what the dominant narrative was around public safety and gun violence in the county, examples of activities and campaigns that we utilize to shift away from the dominant narrative, where we are now, and then we'll wrap it up so that we can get some good questions from you all. And so I will pass it off to Karen.
Thank you. So we'd like to start off by talking about where we're starting from. And we've called this what the narrative was, but in some circles, this is still what the narrative is. So we'll tell you a little bit about the starting place here. So one message that we hear a lot, and we're really talking, so Nathan focused on people's internal and family and community narratives. We're talking more about public narrative, which of course contributes to internal family and community narratives. One of the messages I hear a lot and have heard a lot doing gun policy work is there are two different groups of people. There are gun owners and there are criminals, and these groups of people don't overlap. Gun owners are a noble, good force for their communities. Criminals are two-dimensional bad people who do not deserve compassion and need to be punished out of their bad choices. This still is a narrative in some circles, but we feel this shifting even over the last 5 years or so. Another narrative that we hear a lot publicly is that gun violence is an individual problem. Gun violence is about an individual person choosing to make a bad choice. This ignores a lot of factors that contribute to gun violence, including community conditions, trauma history, corporate behavior, public situations, community divestment, etc. Working on safe storage, I hear a narrative a lot that children who are obedient and well-behaved and have been trained well by their parents won't touch their family's guns. So there's no need to knock up or lock up guns if your children are obedient because they know not to touch them. This is something that we have learned the hard way is not correct, but this was the dominant public narrative, and we've definitely seen that shifting. And there's this other narrative, and I'm sure we have all heard this. If there is a bad guy with a gun, the best way to stop them from harming people is to have a good guy with a gun intervene. This is kind of a vigilante narrative. We've unfortunately seen it in action, including the murder of a teenager in our community by someone who was an adult who felt that they were preventing crime by killing a teenager in the parking lot of a sporting goods store. This is a really toxic narrative. We're feeling that our pushback against it is starting to work. There's also been a narrative that government is not who can help with problems about guns. So we hear a lot, oh, you say that you're just trying to give people gun locks so that they can lock up their guns. You say that you're just trying to get people to bring unwanted firearms to a gun buyback. Well, obviously your secret agenda is to take everybody's guns away. Government can't be trusted in this area. You don't have good intentions. You're clearly up to something. I have been publicly accused of having a secret agenda as part of my work, and that is a narrative that's not only untrue, but creates danger for the people who are doing the work. Ariana talked about the community violence intervention work that our programs do. We have heard narratives even put forth by local journalists, even recently, that community violence intervention, harm reduction, or supporting both victims and perpetrators of crimes are enabling. They're creating problems with crime. They're soft on crime policies that shouldn't be allowed. And related to this last narrative that incarceration and harsh punishment are the best possible solutions for gun violence. Nothing else is effective, nothing else works. So I have a feeling that people have heard narratives like this doing violence prevention work. This is what we're working against, and this is where we're starting. So next slide, please. And Ariana, this one's me too, right? Okay, great. So what happens when these narratives are unchallenged? One thing that happens when these narratives are unchallenged is increases in violence. Violence prevention isn't empowered and supported, and people are in situations where they are actually unsafe, including both young people and adults. Another part of the impact, we say silos a lot. As a person whose extended family are farmers, I always raise my eyebrow at this one because I just think of grain silos, but nonprofits were operating in silos. So Seattle has a lot of youth serving nonprofits, and a lot of people with lived experience of gun violence decided that they wanted to contribute to a solution, started small organizations, generally scrappy nonprofits that were not getting the funding that they needed to do what they wanted to do, but were doing some really good work. Nobody was really supporting these folks talking to each other. So there were all these groups of people doing work in their communities. There wasn't connection, there wasn't coalition, there wasn't overarching collaboration and strategy. And what that meant was the good work was disjointed and people weren't joining forces in a way that could be maximally helpful. I talked a little bit before about divestment. As many other places do, Seattle has a history of redlining. And when you look at maps of health disparities, when you look at maps of communities that have been most impacted by violence, surprise, surprise, it lines up nicely with the maps of historical redlining. In communities where segregation is enforced and continues, there's a lot of victim blaming. So I think if we were all in a room together, I'd ask you to raise your hands if you have heard narratives about quote unquote bad neighborhoods. Don't go to that neighborhood, it's a bad neighborhood. Don't go there. The sidewalks are all cracked and there are shuttered businesses and you're not safe on the streets. Don't go there because people are bad and you won't be safe. Narratives about gun violence lead to community disinvestment. Businesses don't invest in those communities. People don't feel they have the power to get things fixed, like a tree growing through a sidewalk. And that is just a snake biting its own tail. It's a circular situation. There's also great spreads in misinformation. We feel like these narratives empowered racism and victim blaming and did not help anybody. Those are part of misinformation. Also, another form of misinformation is just a complete lack of acknowledgement of community assets, all of the people who were doing good work, all of the families who were creating safe spaces for their neighbors. Without acknowledging those supports, positive community assets, and the really good things that our communities were doing to support each other, completely invisibilized. More residents were living in fear. People were uneducated about the root causes of violence. It's really easy to fall for a narrative that if someone gets into a bad situation, it's because of their choices. It's easy not to look deeper. And these narratives kept people from looking deeper. People were uneducated about what was being done to address gun violence, including by the King County government, by our partners at the University of Washington and Harborview Medical Center, by community-based service providers. And almost half of homes in King County did not properly store their firearms, leading to an increase in gun violence. Next slide, please.
This is you, Karen.
Great. So I'll start to talk about what we did, and this is all pretty self-explanatory. We did research, primary research. We did community listening sessions, put out community surveys to gather information. We did focus groups with firearm owners about what messages would be compelling for them about safety. We also did secondary research. We pulled data from what other people had been doing, field data, and published research, just to wrap our brains around what was actually the state of affairs with this problem. And I'm going to hand it back over to Ariana.
Perfect. And in addition with doing the research, we also started building out some plans. So we have a communications plan that is built every year. We also work in public awareness campaigns, and started doing some planning around like how we can change the narratives and utilizing the research that we had also gathered to decide just kind of like where are our community providers, our community partners, our residents, our elected leaders, just figuring out where they were in terms of understanding a lot of the things that Karen had spoke about in terms of like the dominant narratives. We started planning community events as by way of kind of using those as public awareness campaigns to educate communities about the root causes of gun violence, what they can be doing to prevent it, and helping them to understand their role. And then also harm reduction events, lockbox giveaways, as well as now we have like Stop the Bleed trainings. But we worked all these in and began planning those out. And then we also implemented. So we held harm reduction events like lockbox giveaways, and brought in our community providers to support with those. And so our community providers actually hand out the lockboxes at lockbox giveaways. And in those times, we're bringing in folks from diverse backgrounds and folks who have diverse perspectives. A lot of those gun owners who live in some of the rural parts, I would say, of King County coming in space with our community providers who are Black-led organizations and hearing about the work that they do helps with changing that narrative because folks are brought into a space with folks that they wouldn't typically be around. We had public awareness, or we implemented public awareness and education events. And so speaking about the root causes of gun violence and using events and activations to educate folks about it. Community engagement, we went to public safety meetings. We began engaging with survivors of gun violence and young people to support them in learning more about the root causes and also listening to them and hearing kind of what their understanding of it was. Coalition work, we have advocacy partners within that we have contact with to support, or like we use them to support us in driving the narrative change work, because a lot of what they're doing is advocating on different policies and stuff at the state level. And so we make sure that we work with them. We held briefings with community folks, with our elected leaders, and explaining and educating them on what's being done in King County to address public safety and gun violence. And then also storytelling, which is my lane with our team, but we utilized earned media. And so working with reporters even goes back into that briefings bucket too, holding kind of educational briefings with reporters and talking to them about the work that we're doing and about the root causes of gun violence, the proliferation of guns, et cetera. And also supporting them and telling better stories about how residents can see themselves in the solution. We utilize our own media channels. That counts as like our social media. And then also we have a community-based resource guide, which I will show in a hot second. And then we utilize some creative communications activities to also educate folks. And so I'm going to breeze through these examples of storytelling to educate, drive narrative change, and raise awareness. So why storytelling? So for us, like because we're in public health, like our role is to educate the community about health matters. There is this intersection between public safety and health. And so our role is to ensure that our residents are informed. And then storytelling, I love to say this, storytelling allows for putting the public back in public safety. And so part of one of our creative activations was a comic. And it's a comic that we've been working on. It's a series on the community violence intervention field. And this is co-created with community. And we believe in culture keeping. So our community providers are the ones who are on the front line doing the work. And so we kind of serve as, I like to say, like a little vessel in supporting them in telling their stories. And this was one of the activations for that. We sat down with Mark, who is pictured here. Mark is a real person, and we did a listening session and drafted up a nice little comic that summarizes how Mark and his team, along with the other violence interrupters that we work with in King County, build relationships with young people, intervene, and because of their relationship building, can intervene during crises. And then also the next comic, you guys get a little sneak preview, will be our hospital-based intervention. And we do kind of a day in the life of a hospital-based intervention worker. In terms of own media, you see here, social media, websites, blogs, etc. So we did 100 Days of Action last year. That was a really big initiative. And we had like a public awareness campaign where we pushed out different statistics. We had community partner highlights, national partner highlights. We put out blogs about what it meant to take a public health to gun violence and how we're doing it in King County. And we also have a regional gun violence prevention community-based resource guide that we utilize. And anytime I show up in space of like a public safety meeting, I always tell our communities that they are able to send me different organizations or resources that are currently available that we might not be privy to that they believe should be on this resource guide. And we're pretty responsive in terms of getting them added. In terms of earned media, we reached out to our partners at the King County TV as well as media partners, and we had different spotlights on our community providers so that folks could better understand what they were doing and the role that they play in in public safety in King County. And then we also have a bus banner campaign with King County Metro, where as you see on the screen, we have the Together We End Gun Violence bus banner that does ride around all over King County and has a link to our community-based resource guide. And then kind of still with the earned media, we did a big, we did a week's worth of episodes on our community publication. It's a Black-led called Converge Media, where we brought on different folks to show what the public safety ecosystem looks like in King County. Karen was also one of our lovely speakers during that time, but this is Trayana Holiday, who is the host of that show, sitting down with a young person who had been very impacted by one of our community organizations and is now working for that community organizations to impact other young people and keep them out of harm's way. Okay, and so I will hand it back over to Karen.
Yeah, I'll breeze through these last couple of slides. I hope that's okay, Michaela. So part of what we are doing is creating messengers, people who are trusted to tell the story and helping people share our narratives and tell the same story. So these messengers include healthcare providers, journalists, we are trying, we're getting there. Elected leaders, we are also trying and we're getting there. Community members, residents, young people. If people are sharing the same narratives, then we are better able to work together and create cultural change. Next slide, please. And this is where we are. So back in 2018, I got a death threat for talking publicly about safe firearm storage. That's not happening now. There's an increase in people talking about harm reduction, asking how they can get involved in promoting firearm safety. There's an increased understanding in our communities of the root causes of gun violence and what's actually happening in King County. The actions that we're taking as a community, as multiple partners in multiple places, are no longer invisible. There are increased investments in our work at the local and beyond level. There are better cross-community relationships, more solidarity and collaboration, and our events are drawing extremely diverse audiences who would absolutely not be in the same space and communicating with each other under the past narrative.
Okay,
Next.
so in conclusion, we recognize that narrative change is a part of a process of cultural change. There are a lot of dominant narratives that are out there that we are working every day to combat. And shifting the narrative starts with education and buy-in. Once we were able to do the research, get surveys, sit in on listening sessions, hold listening sessions, we had a better idea of where people were at. And we learned that people needed to be educated about some like different ways to address public safety and gun violence, specifically in King County. And I always love to stress that changing the narrative takes a lot more than just traditional communications methods. I'm in a lot of spaces where I hear folks talk about, like, I want to change the narrative. So, how do I get this reporter to write about it this way? And I'm like, well, does the reporter know? We have to educate folks so that we're all singing from the same songbook and are able to kind of change thinkings in a lot of ways. And I believe that that concludes our presentations. I will hand it back over to Michaela.
Awesome. Thank you so much. I have seen both presentations, and yet in both I've been taking notes of like new things that I am learning. So thank you. And we're going to have Nathan join us back on the Zoom screen for a good 10 minutes for Q&A, which is really impressive. As Nathan noted, there were a few questions related to some programmatic related things. We can start there, and then I saw some questions in the actual Q&A feature on Zoom. Nathan, would you quickly like to address the question about how youth are referred to your services and the question about evaluation?
For sure. We have a variety of referral processes for how we work in our youth program. So currently we are working with school districts, with after-school based programs, and with the city municipal court system, as well as our county juvenile justice system. So there's a few different referral processes that we do. Some of it is self-referral, word of mouth, like kids come to us because they want to be a part of our programming, and we do fun retreats and activities and community service. Kids are interested in that. We do referrals from social workers at schools or administrators. And then the final process would be like caseworker, probation officers refer students with records to us, and they say, as part of your community service and probation, if you for some of the kids or their contracts, you need to be a part of this leadership development program. And it's really a character and leadership development, but we don't advertise character development because people say, "What's wrong with my character?" And nothing at all. It's a leadership development program that we take students through, and that's part of their probationary case. So there's a variety of referral processes. Those are kind of the typical 3 or 4. Let's see, the other question, as it relates to the evaluation, do you think your youth population is different in meaningful ways to the population included in the comparative recidivism statistic? Yes, great question. So that statistic of how students, specifically within our partnership with the county juvenile system, have a 2.6% recidivism rate after they graduate our program compared to 24%. Those include the same kids and the same county units. So it's actually from it's the same population. So that's part of why the evidence was so, and some of that information just came out in the last couple of weeks. So it's like very fresh evidence. But that was kind of how we felt like we demonstrated such a positive impact through our work and our programming, was that, if we're working at the South Side County unit and the West Side County unit, the averages of recidivism rates there was 24%. But when they participated in our program and graduated, it was, almost 2%. So same population we're working with, and it really speaks to the evidence, I think, of effectiveness. Let me see. Are there any other questions, Michaela?
Yes, there's actually a question in the Q&A. It shows up as anonymous, but based on how it's written, I think both of these questions were asked by the same person. And this is for all 3 of you. Thinking about, they specifically mention having conversations with folks who are maybe on the other side politically in Texas. And then similarly in King County, how you're talking with journalists and elected leaders, really anybody who might not necessarily have the same mindset, have the same perspectives that you all have. How do you navigate those conversations? And whoever would like to get us started, feel free to jump in.
I was going to say, I'll start. Karen, I can pass it off to you. Briefings have been super helpful for us. We actually do have like our council and elected leaders who reach out to us to hear more about the work that our office does from like a convener and like coordinator perspective, as well as our community providers. And we always bring our community-based providers into those convenings so they can speak about the work that they're doing with young people. And the way that we explain it is that like what we're doing is complementary to what they believe to be a more traditional way of public safety, right? So like we always explain that with our community-based providers, that it's complementary to our law enforcement efforts. And so we're not trying to take away from that. Everybody has a lane, and we always explain it like that. Our tagline is like, everyone has a role to play in preventing violence. You as a resident, you do, elected leaders. It's just a matter of finding your lane. So we can speak to our lane. We can bring in our community providers to talk to you about their lane. And that's how we've gotten a lot of like good reception from it. And then same thing with our reporters. A lot of what we do when we're doing briefings is educational. So we're not just going in and just answering their question. If they're like, do you fund this? We're not just like, yeah, like we go in and we're like, yes, and let me tell you a little bit about what they do. And if you'd like for us to connect you with them, we're more than happy to do this. And this is also what's happening across the country. So that's another thing. We do utilize our national partnerships and folks within our peer network, as far as like our office for our program, for our Office of Violence Prevention Network, and bringing folks in who can also speak to what's happening across the country. So that's been super useful for us. So I'll pass it to you, Karen.
Oh, yeah, thank you. So in the policy space, I obviously spend a lot of time talking to people who have differing perspectives on violence prevention. One thing that has really worked for me, and I don't know if anybody has seen this website put out, I think by the American Public Health Association, called Urgent Related Preventable, that talked about the linkages between adverse childhood experiences, overdose, and suicide, and talked about shared messaging. So I try to use a lot of shared messaging when I'm doing legislative testimony or communicating with elected leaders. Even people who don't agree with us in general about gun policy would probably prefer that nobody steal their gun and use it to kill someone else. They probably would prefer that the gun industry not manipulate them. They probably would prefer that their community be safe. And so we can hone in on shared priorities. And I have the advantage of previously working on suicide prevention. So I can say, remember all this legislative stuff you all did bipartisanly about suicide? Now it's time to invest in this other thing. You can use some of the same strategies. It has a similar impact in our communities. You know how to do this. And for example, supporting mental health care and supporting gun policy are not opposites. You are the state legislature. You are able to do both. So I'll stop there for now, but I have a lot more to say about that if anybody wants to connect offline.
I think maybe to add on to that, I feel like Karen and Ariana touched on all the things I was going to touch on. I think maybe just to add on and emphasize is that when we're talking with people who may have different perspectives on justice and approaches to discipline in schools or different things like that, I think it's important to be strategic about using strategic language that we're gonna do the work that we're doing, but especially in today's climate, politically and across the nation, like in how schools are approaching discipline, teaching certain materials. It's just important to be very strategic about the language that you're using and finding shared values. I think when people, you mentioned this, Karen, like people have shared values regardless of maybe different approaches to implementation. Like no one wants violence in our communities, right? But we have different ideas of how it's happening and how to address it. So using stories, I think Ariana, you mentioned this as well with your staff, like bringing your staff members who can tell the stories of the impact that's happening in the community. I think that's a really good way to touch people's hearts and to open their minds and perspectives on ways to approach issues. So strategy in language, shared values, and storytelling.
Great. I think there's one more question, and we actually have time for one more, so this is perfect. Specifically for the Seattle King County team about funding, if it's a mix of general funds, grants, just kind of a general overview of what the funding landscape looks like for this.
Yeah, so as with all public health issues and all violence prevention issues, there's not enough funding for the scope of the problem. I'll just start by saying that. However, we are fortunate in Washington that our legislature established the State Office of Firearms Safety and Violence Prevention, which is one of our major funders. That was a great example, actually, of being able to use messaging about the success of suicide prevention initiatives to support violence prevention initiatives. We did some really effective legislative work on that. They're a grant maker. They fund our safe storage work and also the community violence intervention work that Ariana's work group is doing. But we blend together lots of different funding, including local general fund, including some smaller grants. And Ariana, you can talk more about what your group is funded by. My primary funder is the Firearm Safety and Violence Prevention.
Yeah, we were funded through Clifford dollars for some time, but I believe we've shifted over to general funds. Has been our thing, and we also do apply for grants and utilize those to support our community providers as well.
Awesome. Thanks so much. Woo, we're right on time. So I will go ahead and close this out. Thank you, Ariana, Karen, Nathan, for your amazing presentations today. Thank you to the audience for being engaged and asking questions and participating in the chat. Recording and slides will be shared via email to everyone who participated. And this recording will also be posted on the Big Cities Health Coalition YouTube page. And so, yes, thank you so much for being here. Really appreciate it. And we'll go ahead and give you the rest of your day. Thanks so much.
Thanks, y'all.
Thanks, everyone.